you are welcome to do so. Please just call up, sign up, get in, and you're welcome to come back every Monday and Tuesday to help you get it done. Okay? Does that work for all of you? How about you, young lady? Did I answer your question right? So, yes, you can come back and it's free. Okay? Is my microphone on? Are you back yet? I'm glad the classes are helpful. All right, let me know if that worked for you. Section 6, individual policy provisions. Individually. In a contract, we have mandatory provisions and optional provisions. Now, mandatory protects the customer, but optional is at the discretion of the insurance company. So, let's start with mandatory. Mandatory has 12 provisions and required to be in all health policies. Okay? We can change it a little bit, but it still has to be favorable to the customer. No matter what, it has to be favorable to the customer. Now, number one is the entire contract. It stands to reason you'd want a copy of the policy, application, amendments, and any riders that make up the entire contract. Everything has to be in there. Mandatory. Any changes must be requested in writing and signed by the officer of the company. There are two parties to the contract, the customer and the insurance company. So if we change it, the insurance company has to sign it, have an officer that can sign it, and put it into force. We, the agents, cannot modify it. Remember this time limit on certain defenses? 2 years. During the first 2 years, the incontestability clause, we can contest you. But anything that goes beyond 2 years, excluded beyond the 2 years, we're on the hook for. Except for fraud, we can cancel you for fraud anytime we want. Alrighty? So, the grace period is mandatory. Now, grace periods vary. If you pay your premiums weekly, then there's a 7-day grace period. If you pay your premiums monthly, then it's 10 days, 31 for any others. So I remember weekly is 7 days and 7 days, 7 days weekly, 7 days premium, 7-day grace period. Everything else is usually 10 days and 31 for specific others. Mandatory deals with reinstatement. This allows the insurance company to reinstate a policy if the customer pays past due premiums, highlight past due premiums, highlight prove you're still insurable, don't want to just reinstate you for the hell of it, and you only have 45 days to make your decision. Now here, accidents are covered immediately, but sickness is out for 10 days. So accidents immediate, highlight accidents immediate, and sickness 10 days, just in case there's a pre-existing condition. Now, when a claim is filed, we don't want it to take 10 years. So customer files a claim, they notify us. The customer must notify us within 20 days. Now, once the customer notifies the insurance company, we will send you the claim forms. We're supposed to do it within 15 days. Nowadays, it's almost the same day. So you tell us about the claim, we fill out the claim forms, we send you the claim forms. Now you have 15 days, we have 15 days to get them to you, and then you fill out the claim forms, and that becomes what? Your proof of loss. So when you get the claim forms, fill them out within 90 days, but no more than a year, and that files and becomes your proof of loss. So it's notice of claim, 20 days. Fill out your claim forms. We'll get the claim forms to you within 15. Fill them out, becomes your proof of loss, 90 days to 1 year. Time payment of claims, immediate. Upon proof. Highlight immediate and proof. You file the proof, we'll pay it. Payment of claims can be made either to the insured or the beneficiary, whoever's still around. Okay. Benefits may be assigned to a healthcare provider. For example, I gave you my parents when they were receiving long-term care benefits from people that helped take care of them. The company billed us, and we had it shifted to the healthcare directly to the insurance company. That way, they're staying in touch with each other. Now, the insurance company, under mandatory provisions, allows for physical exams and autopsies, except where prohibited by law. There's a few places that are prohibited. Legal actions, just like yesterday, you have to wait 60 days, but no more than 3 years. That's the statute of limitations. And you have to highlight proof. Prove what you're asking. If you don't give us the proof, what are we supposed to do? How are we supposed to know what to do? Change a beneficiary. Who owns the ownership rights? The owner. The owner of the policy has the right to change the beneficiary. And it becomes effective. Highlight the date request is signed. Effective date signed. It's immediate. So you better be nice to the owner of the policy, right? So the time limit on certain defenses generally terminates insurance companies' right to void a claim if more than how many years? Same today, same tomorrow. How we doing? Nice. Good job. Young lady, did you hear my answer that you could come next week and it's free? Sorry about your flat tire. Okay, it's not one. Close, but it's not one. It's certainly not 10. Looking good. So it's not D and it's not A. It's not C. So it must be B. 2 years. The incontestability clause, yesterday and today. Okay. D to B. You got it. All right. I'm wondering if that young lady that asked that question ever heard came back. Um, oh, there you are. So you got my answer to your question. You're welcome to come back. I just messed it up. I did. I'm sorry. Yeah, it's not 3 years. It's not three. It's two. The incontestability period, as we've already learned, is only 2 years. Ah, yeah. 3 years is the statute of limitations for you filing your proof of loss. Okay? The incontestability and the suicide clause both are 2 years. All right. All good. You got it. Okay, so B is the correct answer. Optional benefits. So those are the mandatory ones that protect who? The insured. Optional are at the option of the insurance company. We may or may not invoke them. Who knows? So it's at the insurance company's option. Highlight that. It's designed to protect the insurance company if we exercise it. So if the customer changes to a more hazardous occupation and doesn't tell us and doesn't pay the premiums for the higher risk, your benefits will be paid, but they'll be very minimal compared to what you thought you were going to get. If you go from a hazardous to a less hazardous, highlight hazardous, reduced, hazardous, less hazardous, you'll get paid the same. That's it. But your premiums are going to be really high. So tell us that you change to a lower occupation risk, or if you go from low to high, tell us so we can cover you for the amount of the higher risk. Misstatement of age. If you lied about your age, we will still pay what premiums would have paid at purchased at correct age. If over the limit, then premiums are refunded. No time limit for discovery for your misstatement of age. If you lie about it, then you're on your own. Huh. What happened here? You had several questions on optional provisions on the test. Okay, let me finish this part and we'll go back. All right. All right. Thanks. All right. So misstatement of age. Damn this thing. It keeps jumping your messages. All right, other insurance with this company. If you have two policies covering one claim, we will cancel one and return the premiums for the excess. If you have insurance with us and somebody else, then each will pay its proportional share of interest, like percentage. So it'll either be equal, 50-50, 60-40, 70-30, 80-20, or 90-10. And relations of earnings. So loss of time benefits may not exceed the monthly earnings of an insured's average earnings for the last 2 years. The monthly benefit cannot be reduced to less than $200. So maybe you have a disability policy and you haven't been working, and then you try and file a disability claim. We're not going to be able to cover it because you have to look at your last 2 years of earnings. So if you don't have any earnings for the last 2 years, the most you'll get will be highlight $200. Unpaid premiums allows the insurance company to deduct premiums, highlight deduct, from the claims during highlight grace period. Just like yesterday, we paid death claims if the customer passed away during the grace period. They didn't have time to write the check, or it wasn't their primary thought. Conformity with states. Circle the word state. You will automatically conform to the state you're in, period. There's big differences between the states. If you do anything illegal, benefit denied. Any intoxicants or narcotics, benefit denied. Cancellation, the insurance company can cancel you with 5 days notice. Unearned premium can be refunded pro rata. What's the word for pro rata? Proportionately. So if the customer if we, the insurance company, cancel by the insurance company, we will give you the remaining premiums back in full. Now, if the customer cancels, which is usually the insured usually does, then it's a short rate basis where we charge a cancellation fee. Remember, we have a fiduciary responsibility to maintain the contracts, for example, and that's what we would do, charge them for taking care and closing out their account. If an insured fails to notify the insurance company on change of occupation and the new occupation is higher risk than the former occupation, the change of occupation provision allows the insurance company to do what? We reloaded the exam and there were 20 questions on those provisions. Holy crap. I also had 50 out of 150 just in Tennessee law. Oh. So maybe your state, Tennessee law, has specific provisions to it. May I direct you to them, the home office, to help you with those, please? Because I'm not going to be familiar with your Tennessee issues. And I can see where you have a lot of questions. And they should be able to help you out. Okay? Tons on the APA. Wow. All right. Do that. And they should be able to help you out on your state specific stuff. That's amazing. That's the first time I've ever heard of that. Oh, you're welcome. Okay, final answers? Looks like we agree on D. Reduced the benefit proportionally in relation to the actual premium paid based on the higher risk. In other words, if the client goes from a low risk to a high risk, but they're paying premiums on the low risk, doesn't it make sense we're not going to pay the claim based on the higher risk? You didn't pay to play. You didn't tell us you went from low risk to high risk. So we'll still pay you a benefit, but it's only going to be based on the actual premium paid based on that higher classification. D is the answer. Way to go. Next we have other, oops. All right, so we're going to do that. I'm sorry, I was going to go back, but we don't need to now. Optional provisions and clauses. The free look. That's where you finished delivering the policy. You've explained everything, done everything you're supposed to. Now you're down to the customer's right to examine the free look period. Not less than 10 days, not more than 30. 30 days is the required long-term care and Medicare supplements programs. All right? So if you're a senior, you're going to get 30 days. Otherwise, it's 10 to 30 days. The insuring clause. What's the only benefit of the insuring clause? The insurance companies highlight promise to pay. The insured clause is the promise to pay. The consideration clause. The considerations both parties must meet in order for the policy to take effect. Consideration is the exchange of something of value. Write down pay for policy, just like we've written down before. In the contract, it includes statements in the applications and payment of the first premium. Pay for the policy, and then we'll pay to play. Pre-existing conditions. Conditions that are insured receive medical advice or treatment prior to the effective date of coverage. The probationary period. Specified period of time before coverage begins or highlight pre-existing condition. So some policies, disability, long-term care have probationary periods. No waiting period for accident. Say you're renewing the policy, reinstating the policy. Remember, accidents covered immediately because that's not a pre-existing condition, but 10 days for pre-existing conditions. The elimination period, the time deductible, highlight that. 30, 60, 90 days before we begin to apply benefits. The time deductible. Waiver of premium. You want the full paycheck? Give us the waiver. Sign for the waiver. Premiums will be waived retroactively, automatically, in full. There's your premium. Question: what is the purpose of a probationary period in a disability income policy? Good job. Good job, question mark. We have a perfect score going, team. Bring it home. Okay, now it's not as strict as A. It's not avoid all claims in the first 10 to 30 days. It's what? There you go. Nice change. It's not B, allowed the insurance company to avoid any claims due to accidental causes. No, accidents are immediate, right? What's the one thing we don't do immediately? Nice change. Well done. Okay, looks like we agree. It's D. Allows the insurance company to avoid illness claims made in the first 10 to 30 days. Illness. Accidents immediate, but illness 10 to 30 days. Well played, team. Touchdown. Now here, insurance companies, highlight insurance companies, can cancel, highlight cancel, due to highlight non-payment. So there are 6 options here the insurance company has. Non-can is the most wonderful one of the world. They used to be the way we wrote policies was non-cancelable. Now you get guaranteed renewable. So non-can is cannot be canceled, no way. It's guaranteed to renew, and the beautiful part is rates cannot be changed. So whatever your rate is, you get, period. Cannot be, it's guaranteed to renew and cannot be canceled. Non-can is the most favorable way to go. But nowadays we don't use that. We use guaranteed renewable. Now, you say guaranteed renewable to a customer, and the customer thinks, great, it's renewable. Everything is renewable. It's all going to stay the same. But that's not true. It's renewable without proof of insurability, yes. To a specified age, yes. But premiums may go up based on class. Premiums may be increased and go up based on class. So highlight premiums can be increased. Conditionally renewable, renewable as long as certain conditions are met by the customer. Highlight customer, conditions met. Number 4, optionally renewable. It's at the option of who? Highlight the insurance company has the option if they wish to renew. Express period of coverage and not renewable. So this is non-renewable time. You wrote the policy for January to June. It's done, one and done. It's over. It's non-renewable. Just write another one if you want. And number 6, cancelable by the insurance company with a day's notice. Non-payment, day's notice, bam, you're out of there. So out of these 6, which is the best one of all? Write down 1, 2, 3, 4, 5, or 6. Which one is the best? The one you would want. It's not 2. Which is the most favorable? The one that's the best and saves you every time. Perfect. Final answers? Which one is the best? Nice choices. So we know it's not 2. Did you change your 2? Because I don't see it. Which one's the best of the best? It would be number 1. There you go, 2 to 1. You got it. Non-can. Can't be canceled. Guaranteed to renew. But most importantly, rates cannot be changed. Non-can. The most favorable. Which one of these 6 guarantees renewability, but not the premium? Remember, I used to tell agents, be careful with this one. Explain it to your customer. They didn't believe me because, premiums never changed. Well, guess what? One day, LTC policies in a particular category went up by 30% several years ago, but up by 30%. So the answer here is number 2. It's guaranteed renewable, but not the premiums. Premiums increased on class. Yikes is exactly right. That's why I tell you people, when you buy policies like long-term care, if your state allows it, buy a 10-pay policy. You pay for 10 years, it's paid up, it's done, it's gone, nothing can be changed. It's a contract, period. Or paid up at 65, whichever works better for you. But if you just get one that just goes premium, 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 and then the company has a big problem with that, guess what? You're hurt. And you might want to look at your life insurance and add it to that. So there you go. Watch out for the guaranteed renewable. Cost containment deals with managed healthcare plans. We're back to that. Care designed to prevent illness or disease. Illness or disease. More cost effective to prevent losses than to treat them after they occur. Duh. Alternative to hospitals, care may be provided in a setting other than a hospital. Many procedures can be performed on an outpatient basis. It is encouraged to seek treatment outside of a hospital when available to prevent the cost of hospital admission. Remember, they will do anything to keep you out of the hospital, even get you out of the hospital as quickly as they possibly can once you're admitted. So, it's a good idea. Take care of it. And it's really amazing how much stuff can actually be done outside of a hospital. These clinics are getting really specialized in particular areas. Comprehensive case management. A case manager may be assigned to determine the appropriate case of action, like a PCP. May require a referral, second opinion prior to the procedure. Manages the utilization review during your hospital stay. Highlight hospital stay. We're there to observe and measure how we're doing for you. So, one of the things we check for is mandatory second surgical opinion. If you are told to get a surgery and you do not get a second opinion, you will get reduced benefits. Highlight failure to obtain reduced benefits. Utilization review. We will look at you past, present, and future. Highlight past, present, and future perspective. Where are we going with this? So utilization review deals with perspective, concurrent, and retrospective. So Prospective is the initial review. You go in and you see what you need. During your time, you get the concurrent review. Highlight during hospital stay. And then when you're all done, we look over your past, retrospectively look over the past to make certain we did what we needed to take care of you. Okay? Prospective, starting, concurrent, during, and retrospective, reviewing. Pre-certification for non-emergency, highlight non-emergency, like a tonsillectomy, requires the subscriber, the client, to notify the service provider, the insurance company, in advance for non-emergency procedures. We made up a little form. I had a little form that was made up so that if a customer was going in for something, they would have this form, the doctor would sign it, send it in. That way the physician knew that the treatment was going to be done, it was covered, and what rate they were going to be paid. Helped them out. Okay. Now, ambulatory outpatient means you go to a facility and they will help you out with certain things. Highlight all four. Diagnosis and treatment, health education, family planning, dental and vision care. They will help you out on an outpatient basis with all four. Emergency services. What is a bona fide emergency? When I was a paramedic and I would take people to the ER, it was sad because sometimes I'd go in there and it was just filled with people. And they were not life-threatening. Loss of life, highlight that. There were serious complications of my patient, but none of them were loss of life or serious complications, like 50% of them. They finally had to clean out the emergency rooms and do a check-in procedure that would eliminate the confusion of bona fide emergencies. Now, what if I'm on vacation and I'm hurt out of state or out of area? Then you go to an ER room and get taken care of for an emergency. So you can go in for an emergency if you're out of area. Get your help where you need it. And then go back to your doctor. Which of the following is not an example of cost containment? So we went through three of them. Which is the one we did not go through? Yep. You guys are doing great. It's not pre-certification for cancer therapy. You would need that is an example. You would need pre-certification to get the cancer therapy taken care of. So your PCP, primary care physician, sends you to the specialist, and the specialist says when you need therapy, you would need a pre-certification for that. It is highlighted on the printout. See, I remember covering mandatory. I remember covering utilization. Oh, B was already circled? Oh, God. All right, I'm looking for a touchdown. Everybody type in B. Replacement. Jeez. I'm kidding. Oh my gosh. All right. I was just going to eliminate a mandatory utilization pre-certification. Replacement is not. I'm not going to replace your policy. Touchdown. Policy writers. Oh my gosh, here we go. The impairment writer. Write down broken arm. Remember the example I gave you? You can write me a disability policy even if I have a broken arm because 99% of the time they heal normally. When I was a kid, I broke my arm. It's great. It has no problems. Never had a problem. So it's healed. Then you can remove the impairment. The guaranteed insurability rider allows you to highlight guarantees additional benefits without evidence of insurability, referred to as a future increase option because we can in the future increase more. It's found in disability and LTD policies. LTC allows insurance to increase limited benefits at specified intervals. Pretty cool. That's it for section 6. Any questions, comments, thoughts? Let's go through chapter 7, group health insurance, short chapter. Group. You work for a company, it's a group. You join an association like Life Underwriters, it's a group. And it's a natural group. We're not forming a group to get insurance on a discount basis. Now, the sponsor is your employer. So your employer says, hey, let's sponsor a plan for our people. The sponsor gets the master policy. We, the employees, get the summary of benefits. Highlight summary of benefits, also known as certificate of insurance. Highlight summary of benefits. Every year you get a letter from your company saying, this is how much we're giving you. Here's your benefits. And that's the summary of benefits. So the sponsor gets the master, the individuals get certificate, the summary of benefits. Highlight that. So what is issued to the sponsor of your group? There you go. Okay, it's not it's not the certificate. That's what the employees get. What does the sponsor get? There we go. Yippee! Now we're picking up speed. You guys must be getting hungry. There's a lunch break coming up if you finish early. Got it. We all agree on B, the master policy. Nice change, sir. Good catch. Next, we have types of eligible groups. We have people like the multiple employer trust. That means there are multiple employers. In Bullhead City, we had several Wi-Fi companies. So we at the chamber put people together in related industrial classification, Wi-Fi. These were small to medium-sized businesses that wanted benefits and enjoyed knowing each other and building up relations. So we created a multiple employer trust organized by a third party. We got a policy that they could buy insurance from, fully insured and backed by an insurance company. Like my cosmetology and hairdressers. I put lots of those people together. Or my Wi-Fi company. And the trust got the master policy. So this is where you're taking small related businesses and putting them all together, multiple employer trust, or a lot of hair salons. And then we have the MIWA, yeah, Multiple Employer Welfare Association. Oh my gosh. Is that like captive? No, not really. Not really. I mean, you have a Wi-Fi company, I've got one, somebody else has another. We all get together and we hang out, we do things, we talk about ways to improve our business and benefits and so forth. And then, oh, by the way, would you like to put a medical plan into our association? Yeah, we'll do that. If you don't want to stay, you don't stay. Okay? Let me know. You're welcome. All right, back to the MIWA, the Multiple Employer Welfare Association. This is formed by huge companies, highlight large, because they want more favorable rates. They're already a company, just want better rates. So the employer puts the money up. The employer self-funds. The association provides payment for the employee through third-party administrators, TPAs. Now, MIWAs, that portion is not backed by an insurance company. It's funded by the employers of large companies. So when they run out of money, they have a certain cap, then the insurance company sits on top of that, but they rarely use the insurance company. They usually cover their own. All right, labor unions, highlight Taft-Hartley, like UAW, United Auto Workers, who now want a pension. Employer group health insurance and underwriting. Employer coverage. So your employer sponsors a plan. Must meet employer eligibility requirements. Must be considered highlight full time. How many hours a week do you have to work to be full time? Highlight full time. How many hours a week do you have to work? Just two of you know? All right, you guys got it. Highlight 30 hours per week. Well, the slide says 30 because it's 30 hours per week. That's what's required to be full time. So what the status is that if you work less than 30 hours per week, you don't have to be the employer is not responsible for you. You have to get your own plans on the side. Now, if you have over 30 hours per week, then you're covered by the employer. This happened probably about 2 decades ago, 20 years ago, and all of a sudden people were cut down to 30 hours, 25 hours, so the employers didn't have to meet these requirements. So the employer maintains control over highlight the plan, the benefits, enrollment process, you're welcome, and premium payment. The employer cannot discriminate when determining eligibility of employees, but if you work less than 30 hours per week, you're on your own. Even if you have 2 jobs, 2 different places, 30 hours minimum per week. Now, for group health insurance, you should sign up during the open enrollment period. So once the probationary period ends, an employee can enroll during the initial enrollment period. Typically, it lasts 30 days. No insurability is required. It's a group plan. Now, annual enrollment period allows the employee to join at a later date. Changes are permitted outside of open enrollment for certain status changes. Okay? Open enrollment. Sign up when you need to. Now, we can cover children to highlight age 26. Our job is to make sure we do not duplicate and we don't coordinate the benefits. Here's where we have maybe 2 parents working 2 different jobs. We do not want to overinsure. What is our job title? Indemnifiers, having more than 100% of a claim paid. So you have to distinguish between primary and secondary coverage to indemnify them. So the employee is primary, and the spousal plan, the spouse is secondary. So the one that covers the dependent would be the spousal plan as secondary. That way we don't have to deal with, I didn't notice this until now, sorry. How's that for a screen? Sorry, I just noticed it. So employee, primary, dependent, secondary. Now here, when you're underwriting a group, we would go through the experience rating. 99 out of 100 times you go through experience. So we get the census sheet of the employees. We examine the history and claims of that group year to year. Past experience, highlight past experiences used to help predict future cost. So we take all the experience you've ever had, measure it to our premium rates, and that's how we determine your premium and benefits through experience rating. Now, one day, somebody came to me and says, hey, would you please give us a quote on our plan, our health plan? I said, okay. Now here, what happened was I was going through all their paperwork, and suddenly I found out the home office was in Idaho, a geographic location called Idaho. That's right, a lot less expensive than New York and California, and I was in California. So once I found that out, I verified with the company that they would be rated under community rating in the area of Idaho. And so I was able to reduce their premiums by 30 or 40% because we weren't stuck with California or New York. See, 80% of their people were in Idaho, 20% ran around and took care of all the other stuff in their business. So geographic is really, really important if you have that opportunity. Oh boy. Write down Y-U-C-K. Yuck, just like we did yesterday. See, what we're saying here is that you have where you contribute, write down Y-O-U-P-A-Y, you pay. You have to contribute. Don't you love the way they use words? You have to contribute. Write down your 401k. You have to contribute to your medical. you have to contribute to whatever the company put together for you. And 75% of you must participate with that you pay contributory plan. See, back in the day, or like with government agencies, state agencies, they use non-contributory. This is where you write down company pays. The company pays. So the company pays for your retirement, medical, etc. So they design the plans just like they do here, but here the company pays for the plans, and therefore everybody must participate in the plan. So here you look at the benefits and you measure your check and you go, that's cool, and go there, non-contributory. Whereas most companies nowadays are yuck, you pay contributory plans. You have to contribute to the plans. They design them. You just have to see if you want them and contribute. Bottom line. So the employees of a corporation must each pay a portion of the premium for their group insurance. What are they stuck with? You can write down the four-letter word. You bet. Mm-hmm, 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 mm-hmm. Perfect score. It's not C. Remember, non-contributory is where the company pays. This says employees have to pay a premium. What would you change the C to? Looking good. Nice change. Final answers, please. Well, it looks like we are all in agreement. D, it's a contributory plan. Everybody contributes and pays the premium for their plan. Gee, how sweet. To pay into, you got it. Or better known in my way, yuck. I like that. Yuck, LOL. Yeah, I guess it's better to have something than nothing, but whatever. Now here we're going to federal health insurance regulations. The government deals with ERISA. This governs employed-sponsored plans highlight for retirement, welfare, and benefits. It protects the plan's participants, benefits, and beneficiaries by requiring access to the plan information so they can see if they want it or not. Individual managing plan must meet standards of conduct under highlight fiduciary responsibilities. So if you're managing an ERISA plan, you have fiduciary responsibilities that must be met. The employer must provide a summary plan description annually. Summary of benefits, summary of plan description every year, like we just tested earlier. ERISA just got bit by the cobra. Feels like a politician entered the room. Consolidated Omnibus Budget Reconciliation Act, COBRA. This one helps people with at least 20 or more, I like 20 or more, to provide optional coverage to continue it for employees who hit certain qualifying events like termination. So once the company knows about that qualifying event, they must tell the employee within 14 days. You want to continue your plan? We have 14 days to tell you and 60 days for you to decide if you want to stay. Okay? So we find out we have 14 days to let you know, and then you have 60 days to decide what to do. If you say yes, you will be hit with 102% of the group premium paid to the employer. So in other words, you got terminated, you want to keep your policy, so you're going to pay 100% of the premium, and the company is going to charge you 2% because they have to collect your premium. They have to post it, they have to pay it, and then they have to maintain a fiduciary account. Okay? So 14 days, the company finds out, tells you within 14 days, you have 60 days from notification. And away you go. COBRA, the base benefits For loss of highlight termination or loss of full time, less than 30 hours, termination, full time, you get 18 months of coverage. If you're disabled, highlight disabled, you get 29 months of coverage. So the base COBRA benefits is only for 18 months for termination, loss of full-time employment, and up to 29 months for disability. You might have a qualifying event, highlight qualifying event, that takes care of circle your dependents for up to 36 months, not you, your dependents. For example, highlight death, divorce, separation, limiting age 26, and Medicare enrollment of an employee. How much time after a qualifying event the employer finds out and notice is given to you, how long does the employee have to make their decision? It's not 36 months. That's how long the benefits would last for a dependent. But let's say a qualifying event happens. You got terminated or you lost your full-time status. The employer notified you within 14 days. How many days do you have to wait? How many days do you have to make your decision? There you go. It's not 18 months. It's in days. That's right. There you go. That's all right. We're practicing reading. Nice changes, everybody. Good job, team. Final answers? Looks like we agree. Touchdown. It's A. 60 days we have as employees to decide, do we take it or not? HIPAA, Health Insurance Portability Accountability Act, designed to help people with highlight pre-existing conditions. To qualify, you must have had credible coverage first. So that means a group plan, 12 months. Highlight group in 12 months. Or you owned an individual plan for at least highlight 18 months. Individual 18 months, group 12. There can be no more than a 63-day gap in coverage for pre-existing condition health HIPAA to be met. If it's more than 63 days, then you'll be hit with a 90-day waiting period if HIPAA does not apply. So basically 90 days later, you are covered. The cool thing is they always find a way to help you get coverage, right? That's it for 7. Any questions, thoughts, comments? No? Then let's finish off. Let's go to health concepts and tax considerations. Ready, set, go. The Affordable Care Act. You have to live in the United States. You have to be a U.S. citizen, not an undocumented immigrant. You cannot be incarcerated. At the Gray Bar Hotel, you have your own medical plan. Other exceptions, highlight exceptions, would be Indian tribes, highlight religious, highlight hardship, people with low income, homeless, victims of eviction, natural or human disasters. The Affordable Care Act. There are 10 categories to the Health Care Act. Number 1, you have to have ambulatory patient services. You should provide mental health and substance abuse disorders, including highlight behavioral health. That one should be worn out by now. Emergency services, hospitalization, laboratory, blood test, etc. Maternity and newborn, welcome to the world. Prescription drugs, pediatric services, preventative wellness, chronic disease management, rehabilitative and habilitative services. Those are your 10 essential categories for the ACA. Your categories are based in metal plans, known as bronze to platinum. Bronze is the lowest premium, highest deductibles, and platinum is the highest premium, lowest deductibles. So you go from bronze to silver to gold to the highest level, Platinum. How cool is that? You'll love this. Watch the definition here. Termination of coverage. Insurance companies must provide notice of termination or cancellation of coverage at least, highlight, 30 days to last day of coverage. Now watch. If termination is due to non-payment, that's right, highlight termination due to non-payment, first, there's a 3-month grace period. 3 months grace period. Then at the end of 3 months, if you still haven't paid your premium, if the premium is not paid after 3 months, then the policy will be terminated after another 30 days. So basically, you get a 4-month grace period. 3 plus 1, 4. Interesting, wouldn't you agree? It is guaranteed issue, though, designed to eliminate discrimination based on health status by insurance companies. Insurance companies must provide coverage to any person, regardless of medical history or current state of health. Higher rates cannot be charged for substandard risk. See, before ACA, insurance companies had the majority of people were in a group of health plan, not a group, but a health plan system, and they paid standard premiums. There were those that had pre-existing and higher claims histories, and they were charged about 3 times more. So what they did with ACA was they didn't calculate it properly. They thought it would reduce the charge monthly premiums, but it didn't. Because those high risk ones, like the insurance companies knew, would increase the premiums dramatically. The good news is that even with higher risk, substandard risk, you're still going to be put on. But the rates for everybody is being covered by everybody now. That's why they went up, in case you wondered. You have pre-existing conditions. Cannot discriminate against or charge higher rates for a pre-existing condition. You're in. You cannot drop an insured if they get sick. Never seen that. And appeal rights. You can appeal, highlight internally or externally. Internally or externally. So, by eliminating the insurance company's right to refuse anyone under the Affordable Care Act, health insurance in America is essentially referred to as what? It's not conditionally. There you go. You're going to get it, right? You are going to get it. It's not D. We already said that. Oh, no, we didn't. We said A. It's not A and it's not D. What was the whole point behind the ACA? It's definitely not free. Premiums went up double because of it. It's not D. Keep your first one. Don't change it to D. There you go. It's not A. No, I didn't. I'm sure I didn't. The correct answer is B. We got it. Conditionally renewable? Nope. Free access? Hell no. And non-cancelable? The whole point of the ACA was to have guaranteed issue, so no matter what, you could get coverage. Period. That was it. Good job, team. B. Guaranteed issue. It's a consumer-driven health plan. Oh, goody. Let's take a look at this. Consumer-driven plans allow the employers and employees, individuals, to use a 3-tiered approach to funding the cost of medical services and treatment. The plans help control benefit costs by allowing employers and individuals to decide on their health plan funds used. How am I going to use my health plans? This is where we learn about HSAs, MSAs, HRAs, FSAs, and high deductible health plans. So if you have a high deductible health plan, most of them are anyway, then the annual deductible must meet the minimum dollar amount required. The maximum out-of-pocket may not exceed the maximum dollar amount identified by, highlight, the IRS, your friends at the Internal Revenue Service. It may be combined with health spending accounts, HSAs, or MSAs. But limits, health HSAs and MSAs have very limited contributions. Very limited. So, if you want an HSA, health savings account, you have to have a high deductible plan. The benefit of an HSA is cool. You get a pre-tax deduction, just like when you file for a retirement plan. You do an IRA, you put money in, you write that off of your taxes. It lowers your taxable amount, yet you still have the money. You put the money into an HSA or MSA, you get a pre-tax deduction, but you still have your money. The money grows tax deferred. I like tax deferred. And it's tax free for unreimbursed qualified medical expenses. What would be an example of unreimbursed qualified medical expenses? Acupuncture, dental, vision, things like that, foot care. Tax free as long as you use it for unreimbursed qualified medical expenses. So, to have an HSA, you must have a high deductible health plan, high deductible, 2,500, 3 grand, 5 grand. Then you can open a health savings account for pre-tax, gross tax deferred, and tax-free distribution for unreimbursed qualified medical expenses, which gives you a pretty decent savings. But I think the maximum you can put in is like what, 6 grand, 7 grand, something like that. But even if you can't afford to put that much in, put in 50 bucks here, 100 bucks there, because over time it will build up and the money rolls over to the next year. You don't lose it. Now, an MSA, medical savings account, is established by an employer. HSA, you or the employer. MSA, employer. Premiums are highlight tax deductible. Designed for small business, self-employed, for high deductible plans. So high deductible plans like an HSA, MSA is a high deductible plan to open an MSA. Again, with an MSA, withdrawals are not taxable as long as it's for highlight medical expenses, qualified. Highlight unused funds can roll over. That way you don't lose your benefits. So with an HSA, account contributions cannot exceed, highlight the annual deductible amount. 3 grand. There you go. May be an individual or employer, both. Highlight unused monies get to roll over for use in the next year. Account is owned by the individual, even if the employer makes contributions to it. It's a pretty nice deal, isn't it? It's a non-qualified withdrawal. Prior to age 65, you're going to get taxed as ordinary income. Oh, and by the way, there's a 20% penalty if you take it out before age 65. Highlight 20% penalty, taxed as ordinary income. After 65, withdrawals are just like taking money out of a retirement account. Taxed as ordinary income, no penalty. Now an HRA, look at this. It's entirely employer funded and there's no contribution limit in. You could put 10 grand, 100 grand if you want. Pretty nice. Unused amounts can be rolled over, highlight carried over and over. The employer owns the plan, highlight employer retains the plan. There is no high deductible plan requirement. And if the employee leaves, since the employer funded it, the employer keeps all the money. Pretty nice deal when that employer retires, right? Flexible spending accounts. This one's fun. This is an employer established plan. Doesn't require, highlight no high HDHP, or even a medical plan. You just put money into an FSA. This permits the employee, you put money into the account. You get a pre-tax deduction for doing so. Employee puts the money in pre-tax. Highlight that. The employee may withdraw money from the account, again, to pay for what? Unreimbursed medical expenses. Dental, vision, acupuncture, chiropractic, whatever. So it's all funded at the beginning of the year, but it has a use it or lose it by the end of the year or up to 3 months. So we sat down my first time was really a shocker because I was explaining to the people that you don't want to put too much money in because if you do, it's a use it or lose it. I could almost see their shadow disappearing as they've exited through the door. So we had these sheets I created that says, hey, I want to make certain that you get full benefits here. Are you doing any dental? Are you doing any chiropractic? Are you doing this, that, other? And if they said yes, I'd say how much, and then I'd show them how it applied without losing their benefit. Then they kind of stuck around. It's scary though. So use it or lose it. Highlight and star that. Use it or lose it. So a person may not fund an HSA unless you have what? Hmm. Perfect. Perfect, perfect, perfect. Looking good, team. Looking good. Bring it home. Quarterback has the ball. He sits on it, waiting for the receiver to open up. Keep them coming. There you go, team. Picks up the ball, sees a receiver. Which one do I choose? Put your answers in now. It's not A. Designate up to 2,500 of pre-tax income. We didn't mention that, so I don't know what. That's not it though. Okay. There you go. Nice. Well done. All right. We finally all agree. It's C. To have an HSA, you have to have a very high deductible health plan so that when you get hit with illness or sickness or accident, you can take the money from there to pay for your deductibles, your co-insurance, whatever. Save up for it. Now, federal tax considerations for health insurance include you as an individual. Think about yourself as an individual. So here you had a payday. Who are the four thieves of the night? The federal government, the state state you live in, FICA, and Medicare. So when Fed, state, FICA, Medicare have all taken their money out, what do we call that? After tax income. Why is that so important? The government already got their money for taxes, so you're left with whatever's left. It's usually 30%, so you only have 70% left. You use individual after-tax dollars to buy your disability benefit. So when you pay for anything with after-tax dollars, it's always going to be tax-free, no matter what, income tax-free. The benefits will be received income tax-free because your monies that you paid for your disability policy have already been taxed. Anytime you see after-tax dollars, it's always tax-free. Medical, you ever been taxed on your medical? No. Ever been taxed on your dental? No. Hey, are you taxed on long-term care? No. Even if you took a tax deduction, all of these medical, dental, and long-term care benefits are not taxable. The benefits are not taxable even if you took a deduction. Their benefits are always tax-free. Always tax-free, no matter what. Okay, skip the chart. When an individual pays the full cost of disability insurance, disability income insurance, a disabled employee's benefit, when they receive the benefit, you paid for it yourself after tax dollars, how will you receive the benefit? Perfect. Wow, perfect. Bring it home, team. Bring it home. You're doing great. It's not C. It's not non-taxable to 60%. That's if the company paid for it, took the deduction. There you go. All right, looks like we all agree. It's B. Individual paid for it with after-tax dollars. It's tax-free to you. If you file a claim and receive benefits, it's non-taxable in full. We don't care what your wages are, it's tax-free. Now here we've gone from you as an individual to you at a group plan, at the company group. So here, if your employer pays 50% of your premium, for example, and takes the deduction for it, that's what pre-tax means, then 50% of your benefits will be taxable when you receive them. Okay? If your company took the tax deduction and paid 50% of your benefits, when you receive that money, 50% of what you're getting is going to be taxable. So if you have a $5,000 plan and you file a claim, you're expecting $5,000, $2,500 will be taxable in your tax bracket. The part you paid for with after-tax dollars, the other $2,500, that part is not taxable. It's tax-free. Kind of makes you wonder if you should do it, huh? Group disability. Now here we've got medical and dental. We have accidental death. Remember, death is always tax-free. When we pay a death benefit, it's 100% tax-free. And long-term care. All four of these categories are tax-free. I don't care if your employer pays for your medical and dental, your AD&D, or LTC. When you receive the benefits, they're going to be non-taxable. Any benefits paid for with after-tax dollars are non-taxable. They're always tax-free, period. So when an employer pays some or all the cost of your group medical insurance for its employees, the annual amount of each employee's benefit is what? That's right. Mm-hmm. Gotching. You are looking good. Okay, looking good. We got perfect score going here. It's not D, it's not deductible to the employer. I mean, it's deductible to the employer, but it's a medical plan. So it's deductible by the employer, yes. But what they're asking you is when the employee gets the benefit for their medical benefits, how do they receive it? So it wouldn't be, there you go. Excellent. Alrighty. Looks like we all agree. Touchdown. Not taxable to the employee. You never pay taxes on medical. You never pay taxes on dental. You never pay taxes on death or dismemberment or long-term care. It's always going to be tax-free when you receive the benefit. Now, taxation of business overhead. We talked about this earlier. Here you are, you got a business overhead policy that protects the business expenses. So that covers your rent, your utilities, the materials and supplies you need to run the business, and even taxes and utilities, insurance and utilities. So here, the employer was taking a pre-tax deduction. So the employer took the owner of the business took a deduction for buying the overhead insurance. Now, it's because the owner took the pre-tax deduction, when they receive the benefits are taxable. As I shared with you earlier, let's pretend you're a very small business. You bring your stuff to me, I take out a Schedule C, I write off your materials, I write off your cell phones, your rent, your utilities, employee salaries, etc. And it usually wipes out the taxable benefit, the taxable portion. So it really doesn't matter. It just works out for everybody. Key person. Remember that woman that brought in 80% of our business? Aye. We paid for it as a business to protect ourselves against her becoming disabled or dying. We paid for it with after-tax dollars. We're the payer of the policy, the owner of the policy, and the beneficiary of the policy if anything happens to this woman bringing in 80% of our business. So when we receive the benefits, because we paid for it with after-tax dollars, it's always going to be tax-free. Write down Mr. CPA. Buy-sell agreement. Had to sign a contract when he got promoted to partner, saying if he dies or becomes disabled, the partnership would buy the policy from him and he'd sell it to them. So the policy is bought by the company. They pay for it with after-tax dollars. Anytime you see after-tax dollars, it's always tax-free. Everybody wins. Skip the chart, and we're done. How y'all feeling? All right, welcome back. Welcome, class. We did really well. So, any questions, thoughts, comments? How did I do? Did I create your confidence level go up? Connect the dots? What do you think? Good? All right, great. Thank you. All right, what's coach going to tell y'all to do? Take the comprehensive test. My questions were simple, more straightforward. But on the comprehensive test and the actual exam you take, they're going to be wordier. They're going to be filled with smoke and etc. Yes, that's correct. So, definitely look up the comprehensive test. Check out your state requirements. As this one person found out, there's many questions asked in their state exam that a lot of us won't be hit with. Oh yeah, she agreed. So take that comprehensive test. Let it help you get stronger, run with your strengths, get your highest score to 90, get your next one up to 90, etc. Okay? So, if there's no questions, thoughts, or comments, you are free to become the greatest of all people. Go out and be an indemnifier. Make us all proud. Come back for another license. Come back for your continuing education. We are looking forward to you. What abbreviations would you like to go over? APA, American Psychology Association, ANH, Accident and Health. I deal in psychology, so APA is American Psychology. You're welcome for the class. Yay, thank you. Did that help you with those two, young lady? Oh, the exam used tons of abbreviations. Oh my God. Thank you so much for everything. Have a great day. Thank you all. Practice exactly. Practice, practice, practice. Repetition, repetition. Great. Thanks for a lot of information. Y'all feel free to come on back. Way to go, team. How do you sign up for next week? Just call the office and tell them Coach Phillips said to sign up for next Monday and Tuesday. Or just go on, you know how you signed in for the class? Just go there and just sign up for next week. Yep, signed up for next week. Yay! See you next week.